let's move on to the next question. We kind of touched on this earlier. What kind of filling materials are used in current conventional dental practices, and how do they compare to the biological friendly ones? And you did touch on that, but I don't know if you want to expand a little bit about the, because I think that's a big thing people don't realize, is that if they're going to a regular dentist, they're going to get materials in there that could potentially cause toxicity for their whole body. And even with BPA free, there could be other chemicals, if they aren't someone like you who understands what materials are in that, that could really, really wreck their system because of those tubes and because of how interconnected our whole body is and the fluids that go in and out of our teeth.
So materials, again, if we're going to implant something inside of you that's going to be there for 20 years, it makes sense to me to make sure it's not going to harm you. It at least is going to have a net neutral effect, if not a positive effect, but certainly not a negative effect. Obviously, you get into a lot of biological practice, you're not going to see mercury. You shouldn't see nickel. We can just about get away from all metals. I mean, there are some compatible metals that still will occasionally use high noble golds, and people can tolerate some of those. Okay, but it's better in general just to get away from metal, because you also have the issue of galvanic activity, which can be a whole nother topic of potential negative impacts locally and systemically. So we can do, we have the capability to do serum compatibility tests. So if somebody really is concerned about materials, there's labs. Actually, one of the labs that we used forever, Clifford Consulting, was a great guy. He was somebody that with Dr. Huggins really did a lot of groundbreaking study. And I mean, there was a lab he created where you could take a blood draw and they would do serum compatibility. So basically they're testing your blood against every material. We get packets that thick with thousands of materials, and it says, here are the suitable and non-suitable materials. And we used to do more of those, but I think now that we're getting away from metal, the compatibility is, I mean, mercury's incompatible. No doubt. You get into the resins, we can get real specific about which ones have more of this and that and the monomers and blah, 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 but they're going to be so much more compatible than the metal, some of the alternatives. But even then, some patients are just so sensitive, or they're so concerned about it, that we take the extra step and actually do these compatibility tests. And now you've got an objective finding that says this kind of confirms that the materials we're going to use. In our practice, we don't do those routinely. We do them, but we have, based off of thousands of compatibility tests, hundreds, we continue to see certain materials that are suitable for just about everybody. And you would assume that that means that through the manufacturing processes, or there are a few companies, European companies that we use, that actually make healthy materials. That's actually something they try to do. I mean, that's the purpose, is making materials and the resins and the ceramics and the non-metal alternatives, but they want them to be healthy. So compatibility is a priority. So we've just refined our choices down to just a few. There's still a lot of materials that are used in a dental office, but you're not going to see mercury, you're not going to see nickel, you're probably not going to see a lot of metal in general. You're probably not going to see a lot of offices recommending just arbitrary fluoride treatments. You might see some that recommend topical. And again, you could make a case for that. You could do that in a controlled manner where you're not getting a lot of exposure, but you're probably not going to see a lot of biological offices pushing to do fluoride and 2-year-old.
Just so a viewer can understand, like when you say the word compatible, what does that mean, that a material would be compatible with our body and everything?
Well, so the compatibility test, they're just testing one little part of a reactivity of your immune system. So they're looking at a certain little component, and they're saying, well, it's causing a reaction, and it happens to be a part of the immune system that does react to kind of outside influences. But in general, I mean, let's take mercury, for example. It's incompatible. It shuts down. I mean, it shuts down mitochondrial function. it's a monkey wrench in the methylation processes, which can shut
Mhm.
down enzymes. I mean, it's incompatible. It's there's no positive from it.
Right.
Compatible would just mean it again it has a little, if no, effect on any of your normal processes.
Yeah.
It's not going to bioaccumulate and have the risk for causing problems, down the road.
Your
But we
body can
also have
function
to
as it's
acknowledge,
meant to.
yeah, but I mean, I'll acknowledge too, I feel like the materials we use now have shown to be very compatible, but my gosh, who knows in 100 years? I mean, we're doing our best with what we have, but
Yeah.
100 years from now, it's just like the dentist 150 years ago, although mercury was an issue back in the 1850s when they first started using it in people's mouths, they still challenged that. And there was a
Yeah.
faction of dentists surgeons that didn't want to use it. But who knows, 100 years from now, these materials that I'm bragging on, I hope that we don't find out that there's negative. I mean,
Right.
that's just the way that
Right.
it goes. But a lot
Yeah,
of
it's a
effort,
process of research.
yeah, but a lot of effort does go in, and these are well-researched materials. They have tons of clinical experience. I mean, in our office, but
Mhm.
you extrapolate that out over the whole field of dentistry, and you start seeing positives and good feedback, and you see
Yeah.
these materials work, and so
Certain ones that
that's
really work for people. Yeah.
yeah. So biocompatibility. I mean, this is probably a really poor example, but if somebody's allergic to um, let's say something, let's say they are lactose intolerant for whatever reason, they're not compatible with lactose, right? So you
Right.
put it in
Yeah.
versus finding a way, or that's where even sometimes raw milk or avoidance or whatever. That's
Mhm.
so it's not quite that cut and dry in dentistry, but that's kind of what I mean by compatibility. We just want it to have at least a neutral effect,
Yeah.
not a negative effect with unintended consequences.
Yeah.